Mrsa is a skin infection caused by methicillin-resistant Staphylococcus aureus, also known as a staph infection. A Mrsa infection is resistant to most antibiotics, making it especially hard to treat. 1 in 5 individuals have some sort of Mrsa infection living inside of them. Mrsa can be spread from person to person through direct contact with the infection. This means that a non-infected individual can get the Mrsa infection simply by touching a wound from someone who has the Mrsa infection. It can also be spread through sharing personal items such as towels, clothing, or used razors from one person to another. It can also spread through touching used bandages from a Mrsa infection, so be sure to dispose of Mrsa bandages in a separate, preferably biohazard bag. Mrsa infections can be especially troublesome in communal living situations, such as the Salvation Army, because people are living so closely to one another. Mrsa can also be spread through weakened immune systems, so this means individuals who have infections such as cancer or HIV or other colds that their immune system is already compromised, they could be more likely to get the Mrsa infection. A Mrsa infection typically appears as a bump or infected area that is red, swollen, painful, warm to the touch, full of pus or other drainage, and accompanied by a fever. Many people who have a Mrsa infection initially think that they have a spider or other insect bite until the infection worsens. And this is a group of pictures that shows the progression of a Mrsa infection. This is actually from a woman who cut her leg shaving and it got infected after that. So the top left-hand corner is the first in the series of pictures, and that shows the cut 2 days after. And as you can see, there's a bit of reddening and minimal signs of pus underneath the skin. And the next picture to the right is 4 days after she cut her leg. And as you can see, this appears more infected, having obvious pus underneath the skin and a more reddened area throughout. And this is when she noticed that she had an infection on her leg. So this is when she began treatment with oral antibiotics. And the picture to the right is 5 days after her cut. As you can see, it progressed quite a bit in the last 24 hours. There is more drainage and an increased reddened area. And then it seems as though the bump has grown as well. And this is when she began her first treatment of intravenous or IV antibiotics. So that would mean that she'd actually be in the hospital with an IV going into her arm or other site in order to treat this infection. The next picture below on the left is 6 days after the infection, and that is after her second round of IV antibiotics, and she actually had to have the wound cut open and drained after that. So the next picture to the right actually shows after they cut open her wound. As you can see, they had to take out all of the infection, and that is 1 day after the surgery. So you can see that the infection is gone, it's just beginning to heal now. And to the right, the 1 week post-surgery, you can see that her skin has really healed over well, but there is still a mark from where the infection was. And then below, 2 weeks post-surgery, you can see that there's not very much broken skin anymore. It's beginning to heal. And the picture to the right is 3 months after surgery. So you can see that one small infection can progress quite a bit and can leave a large lasting mark afterwards. So it's important that an individual seeks treatment as soon as possible once they think that they have any sort of skin infection. This is an image showing the difference between a spider bite and a Mrsa infection. As you can see, the spider bite has a much more defined border and the Mrsa infection has clear signs of pus. One of the best ways to tell if it's a Mrsa infection is to monitor the pus and see whether or not the growth keeps on getting larger. If you or another individual suspects that they have a Mrsa infection, be sure to cover the sore until you're able to seek medical attention. Your provider will typically drain the infection and provide oral antibiotics, or if the infection is severe enough, provide IV antibiotics in order to clear up the infection. When an infection is drained, it is generally cut open and the pus or other liquid inside is let out in order to promote healing. If oral antibiotics are given, be sure to take every single pill. Don't stop just because the infection is feeling better. If antibiotics are discontinued too quickly, it can lead to infections that are more resistant to medications in the future. If an infection is not clearing up with the medications given, be sure to contact your doctor. It may be necessary to start a new medication. In order to prevent the spread of Mrsa, it is important to provide information about what Mrsa infections look like. It may also be helpful to have a person that can be contacted if an individual believes that he or she has a Mrsa infection. It is also important to sanitize surfaces that are commonly used by many different individuals. You can use a disinfectant or bleach-based cleaner in order to sanitize. Washing clothes properly can also limit the spread of Mrsa. Be sure to use hot water if possible and add a bleach or other disinfectant to the water. It is also recommended to use a hot drying cycle after washing. If a resident or worker is already infected with the Mrsa infection, try to keep him or her away from other individuals or keep the infection covered at all times. Be sure to only use antibiotics exactly as they are prescribed by a doctor in order to limit the ability for other bacteria to form resistance to medication. If there are any wounds suspected of containing Mrsa, keep them covered with a dry, sterile dressing until seen by a medical provider. The drainage from the wound may contain Mrsa. Be sure to encourage any individuals with infections to seek medical attention for treatment. If antibiotics are not started, it could be possible for the infection to spread to other people. Be sure to keep infections covered even if antibiotics have been started. If you have any remaining questions about the spread of Mrsa or the prevalence of Mrsa in your area, please contact the La Crosse County Health Department at the number listed below. Otherwise, please contact your provider regarding specific cases of Mrsa infections.